Alberta Primetime with Michael Higgins.
Welcome to Alberta Primetime. Ahead tonight, our politics panel on a petition pushing back against the funding of private schools falling short. But first, pressure of another sort on politicians.
Alberta wants to create a private health insurance market and drive up costs like in the U.S. Bill 11 will increase wait times in public sector, and it opens the door to hospital user fees. It is truly a disaster for public health care.
Public health care advocates on Parliament Hill this week urging MPs to take a stance on Alberta legislation that aims to expand private health care in the province. Legislation, they say, violates the Canada Health Act. And joining us now, Chris Galloway, Executive Director of Friends of Medicare. Mr. Galloway, good to see you again, sir.
Hi, Michael. Thanks for having me back today.
Okay. And you are just back from Ottawa. You're back in the province. You were we saw you there, part of that coalition meeting with something like 100 MPs, senators as well. What was your message in a nutshell?
Absolutely. We were there along with the Canadian Health Coalition and hundreds of folks from all across the country, including 32 Albertans from 23 different constituencies. And we were meeting with senators and MPs from all parties. And the biggest message of that lobby was the federal government needs to act on what's happening here in Alberta. That Bill 11 is an existential threat to public health care in Canada, that the federal government has very clear responsibilities for enforcing that act, and that they need to speak up and start to act on what's happening, because it won't just impact Alberta, but the whole country if this is allowed to happen, this two-tier American-style healthcare, but also the potential of undermining trade agreements while allowing American insurance companies into Alberta and so on. So really hammering home the point in Ottawa that there's federal responsibility here, and that after months of silence, we're expecting them to speak up and act.
Okay, Bill 11, it's the focal point. Many Albertans already know. Legislation passed by the Smith government in the last sitting that will allow doctors to work both public and private health settings. Put perspective on why you feel that is worrisome.
Well, it's a very clear violation of the Canada Health Act. So in terms of the federal government, they have a responsibility to enforce that act, to administer it, the funds associated with it, the billions of dollars we receive to ensure public access to healthcare across the country. So we need them to step on that. But in terms of the legislation, it's very blatantly clear that it's two-tier healthcare, that those who have the financial resources will be able to pay to skip the queue, get quicker care, and the rest of us will be left waiting longer or going without, because right now we don't have the workforce for two systems. Allowing people to work in both systems at once will automatically make a profit motive that ensures that those who can, with the resources and the money, will get care quicker. And we think that's unfair and a very blatant violation of the Canada Health Act and the value of Canadian Medicare and equal access.
Why do you feel the Alberta government would risk violating the Canada Health Act? Why push that boundary?
I think this is their goal, is to set up two systems to get rid of our single-payer healthcare in Canada. It's an ideological choice that they always think private is better, even as things like DynaLife and their lab privatization or the surgical initiative have actually made things worse while costing us more. They constantly come forward claiming by doing this, we're going to save money, we're going to shorten wait times and increase capacity. But once they put these things in place, none of those claims have come true in the last few years. And there's Auditor General reports and other evidence that shows, including the government's own evidence on surgeries, that show that this doesn't work and it won't work. But they're pushing it forward anyways because it's an ideological choice.
How do you see the insurance industry factoring into the conversation?
We see Bill 11 as a gift to the insurance industry. They're bragging that they're at the table with the government to help implement this legislation. And right now, under trade agreements with the United States and others, we have protections for single-payer public health care built into those agreements. If Alberta willingly allows American insurance companies into our province to ensure services that are medically necessary and already covered under our public plan, what does that mean for Alberta and the rest of the country once those corporations are in our country, operating, having legal standing? We need the federal government especially to look at trade agreements and the impacts of this legislation, because we're opening the floodgate to the Americanization of our healthcare system without much of a debate.
Okay, so maybe on that point, how close then do you feel Alberta is to crossing that threshold to American-style healthcare?
We're very worried that we're very close. We're waiting for the regulations and the implementation plan. But once we open that door, it may be impossible to close it and push back. So we're really in a crucial moment. And that's why we were in Ottawa with folks from across the country. And that's why we're touring the province, having town halls, because this is the moment that we need to have that debate. Do Albertans and Canadians want two-tier private healthcare, or do they want to keep our single-payer universal system? And that's the choice in front of us, and it's coming quickly at us. So we need to have that conversation, and we need to see federal leadership, and we need to see Albertans and Canadians speaking up if that's not what they want.
Okay, so then let's cycle back to where we started. Were you able to meet with the health minister? To what degree is the Carney government prepared to engage with you on this?
Yeah, unfortunately, the federal health minister has been missing in action. She's hardly spoken up. She hasn't taken a stance on this legislation in Alberta. We did meet with many members of the Liberal government and all parties on Parliament Hill and senators. We saw questions asked in question period and in the Senate specifically to enforcing the Canada Health Act. So I think our point was made and it was clear, but we're still waiting to hear directly from the federal health minister, who has had time to meet with the private insurance lobby. And we think it's unacceptable that she's not meeting with all stakeholders, including those who support public health care.
Okay, and of the MPs you met with, were you able to meet with any who represent Alberta, be they either Liberal or Conservative? And how receptive, if you did meet with them, how receptive were they to your message?
Yeah, we met with with MPs from all three parties in Alberta. There's an NDP MP, Liberal and Conservative, and we did have meetings with folks from all of them. We had people from 23 different constituencies, and most MPs met with their local constituents if they were in town. And they were receptive. There was a lot of education needed. A lot of people saying, why are you here? This isn't really a federal issue. It's more a provincial thing. And so really trying to make it clear to them the federal role in healthcare, how there's a key role for the federal government was important. And we had really good conversations about that while we're there. And there's more work to do in the weeks ahead. All
right. We'll have to leave it there for time. Appreciate your time as always, Mr. Galloway. Thank you, sir.
Great. Thanks so much.
Chris Galloway, Executive Director of Friends of Medicare.